When you play a Game of Thrones, you either win or you die.
Just like the Democratic primary. Welcome to Care Talk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
So John, Amazon's Alexa's been out for 4 or 5 years at least, and they finally started to add healthcare skills and make it HIPAA compliant. Big effing deal. Yeah?
David, this device is transformational. Mm-hmm. It has quickly jumped ahead of everybody else. It's a device that sits in your home. There are probably 50 million of these out there. And people have immediately started to use it in their day-to-day use of Amazon and ordering. What this creates is an immediate path to help people get access to the cloud, access to their healthcare providers. Cigna's working with them. Boston Children's is working with them around recovery, around wellness. This is a big deal.
All right, John,
voice matters.
All right, John, if I want access to the cloud, I can just walk outside and look up in the sky. This sort of stuff they have, it reminds me of like telephone banking from the 70s. It's like beep, 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 beep. Your balance is $6.97. John, there's a lot that they could do with it, okay? Here's a couple of ideas.
You could join the Luddites.
I could join the Luddites. Yeah. Is there an app for that? But John, here's the thing. You already have people that are working on code algorithms to be able to diagnose respiratory conditions based on voice. Alexa already has a bunch of microphones built in. They have an Alexa that's used for fashion.
So you like Alexa. You didn't like Alexa, now you don't like it.
I like it. I'm just saying, big deal, this announcement. All the things that they're doing with it are pretty small ball things, John. It's like one of those Cirrus clouds.
You're missing
It's way up in the sky, barely worth anything.
You've now got a pervasive access to your healthcare providers. You can call a CareCentrix nurse. There are wellness incentives that Cigna's doing, and there are some great results at Boston Children's around children's recovery from complex surgery. Now you're attacking children recovering from surgery. But it is a big deal, and because it's created a continuous relationship, to your point, not just around order entry or asking for something, but actually listening. That app is kind of interesting
because
one for
you, John.
That particular app, the Res app, can actually predict for COPD patients how sick you are and what you need. So actually, it could be the not the eyes but the ears of the healthcare system helping you get healthier. David, you're missing.
All right, John. Well, listen. So I'm glad you brought up the Res app one from Australia because they are actually moving to children. For the record, I'm not against children, and I think that the Children's Hospital one is the most interesting one of the ones that they announced because it actually deals with transitions of care. But I think you could be more aggressive and ambitious than that. Start in the home. People have Alexa there. Bring it into the hospital. Bring it to the SNF, the aftercare, post-acute care, and then bring it back home. I see the potential. I just think big deal after this amount of time they could do better.
I'm glad you're finally in the details and finally agree with me in a disagreeable way.
Very good, John. You're so pleasant. Now go ahead. What else you got?
There's a lot of news right now bubbling up about measles. Have you been following that?
I've been following it, John. What do you think I've been doing? Just thinking of ways to attack you?
Have you drawn any grand conclusions?
Yeah, I think what happened is that, people, you didn't used to have to tell people that measles was a terrible disease and if you could get vaccinated against it, you should. Now people aren't familiar with measles. They don't think it's any big deal. And so, they may not get vaccinated. I don't think, there's a lot of talk about anti-vaxxers. That's part of it. There's just a lot of people are just sort of complacent, no big deal. And measles is coming back. It's back in New York. It's back in Los Angeles. And I'm probably be back in your town soon.
I mean, it is I think I agree with you. It's a very serious problem. The WHO, the World Health Organization, says it's one of the 10 most dangerous trends in the world, and particularly around the anti-vaccine aspect of it. But there is a crisis of complexity in developed countries. And you saw a little mini explosion in California a few years ago when they allowed exemptions, and a real epidemic in 1991 in Philadelphia, which actually people stopped going to Philadelphia because they were afraid they and their kids would get sick. Measles is a super serious illness. Once you've got that virus, it's a delivery vehicle for bacterial infections into your lungs. We need to take this very seriously, and I actually think we are still kind of complacent, and even from a political perspective, because what Philadelphia did is they made vaccines compulsory, not mandatory where you get fined like New York, like the Mayor Wobbly Bill de Blasio, who can't actually come up with a strong enough position. They made it mandatory, they required it, and that measles epidemic ended, and the kids are healthier.
Exactly. Compulsory, John.
Compulsory.
They actually could go out and get you a jab in the arm, which is what's needed. All right, John, as long as we're talking about disturbing topics, I saw a quite disturbing article, a whole investigation about suicides among older people, and in particular people that were in institutions. Is this a major phenomenon, or is it just...
Well, I think you got to, it may be hard for you to do this, but you need to get beyond the headline, because the headline was really focused
Put my reading glasses on to do that.
Suicides in long-term care facilities, and there's one a day in America. It's a tragedy. It's not actually that big a deal. What's really big is the broader epidemic of suicides in America, which I think in 2017, about 47,000 people committed suicide, and that's roughly twice what happened in 1997. The actual numbers by demographic are not worse for elder Americans. They're quite scary among the 18 to 22-year-olds. There's an epidemic, there's a growing challenge of suicide in America that's part of the broader epidemic of depression and loneliness, and that's what we need to worry about. In fact, even for the elderly and long-term care facilities, if you get into that data, what was scary for me is that 1/3 of all residents of long-term care facilities have thought about killing themselves in the last year. That, I think, speaks to the disconnectedness that we really need to be focused on at every level of society.
Well, John, I thought the piece about what's happening in long-term care was very concerning because, people are put into a nursing home or other long-term care facility for the fact that they won't be isolated. Instead of being isolated at home, they're with professionals. People should actually be taking it seriously, should understand what's happening, and should really do something about it. That, I think, is what's so disturbing there. The other thing you talked about, increase in isolation and depression. I think it's going to get worse because people are going to lose their kind of interest in life, their purpose in life, as the jobs get more automated. Robots are taking over time, which I know you're going to diss me for, but that's just a fact.
Robots are your friends.
People need. That's right.
His friends, particularly.
Your friends, your enemies, and your caregivers. They're going to take good or average care of you, John. And I think it's going to happen. There's going to need to be new forms of social interaction. I actually think there's going to be a comeback of religion as a result of this over time. Something we need to keep an eye on. And in the meantime, hold those long-term care facilities accountable.
Well, I think that you're onto something. Cigna did some great research last couple of years. Dave Cordani, their CEO, is completely on it. And one of the interesting things about their research into loneliness and disconnectedness is that while 43% of Americans feel lonely at times, only 18% live alone. And so you're not actually solving that problem by putting people together. We need more of a sense of community. And I think the spiritual path could be one of them. But it's something that we, as we think about at CareCentrix, creating a path home where people can heal, we really are spending a lot of time trying to reflect on how do we best do that in a way that reconnects people, particularly those who are isolated, back into communities and groups, because there is a real sense that without that, health will decline. You see it in some of the depression statistics, but you also see the opposite, the happy outcome of places around the world like Costa Rica or Okinawa, where people live very long lives and typically die in their sleep. They are built around health, nutrition, and community. And it is something that I think it's not been a priority for healthcare, and we need to make it a priority for healthcare. It's one of the superpowers, the invisible superpowers, or super dangerous trends, unless if we can deal with it the right way.
So, John, I'm going to preempt you on something. I'm surprised you haven't brought it up yet. There was some propaganda in favor of your stance that everything should happen at home. I'm referring to the joint replacement. They said if you're healthy, if it's elective, it's not serious, you're well supported, you can go home and you're going to be in good shape. You know what I'm talking about, John? Let me hear it.
The Journal of American Welfare, JAMA, one of the major academic reviewers, looked at tens of thousands of cases and found that healing at home, which is something that we at CareCentrix take very seriously and are enabling with health plans and doctors and patients, is much cheaper, no difference in mortality, no difference in functional status, and that years later, patients were happy, healthy, and they just saved a lot of money. You're seeing the more of an ability with the right kind of care support and team and the right engagement of patients, much better outcomes at much lower costs. It's the trend. It's the future. It's
Get
important
on
for you
board.
to pay attention.
Yeah. Well, John, I was interested in the joint replacement because I thought it was some sort of new, new replacement cartridge for them for
Not
legalized
just
marijuana.
hips and knees,
But
it could be post-cardiac surgery. This is a trend. It needs to
All
be
right.
done in a sensible way. Stop.
But John, there was one
Look
thing.
at the details.
There was, okay, one detail you didn't mention is that there was actually a little bit higher readmission rate for those that went home. How about that?
Modestly. And if you look at it with the right support, and we believe at CareCentrix we're a part of that. We've got a great readmissions program. We can drive that readmission rate even lower than is happening today from SNFs and IRFs and LTACs. With the right support, we can actually beat the readmission rates that are happening for those who are spending time in hospitals. They just need the right support.
John, we started off this episode talking about the cloud. Now, are you ready for a cloud that's going to dispense some lightning in the lightning round?
I'm ready.
Thunder. John, Medicare paid 840% more for insulin
You're
last year
surprised?
than 10 years ago. What the heck?
It's the same problem we always talk about. Pharma's taking too much, and it's coming right out of your pocket.
Yeah. Well, thanks, John. Well, it's diabetes has gone way up in incidence, and nobody's paying attention to price.
Well, the cartel that actually the three dominant suppliers of insulin are paying attention, and they're getting rich. So, David, Lyft's going public. They say they're going to make it up with volume, and they're focusing on healthcare. What say you?
John, it was sort of a joke to hear them talking about social determinants of health and Lyft. It's not really like a lift. It's more like a drop so far. And I think the idea that you're going to go from $1 billion of loss by serving poor people with helping social determinants of health is a pipe dream.
Well, Lyft is a great company. The ride sharing is a great concept, but fix your own house. Start making money. Find a path there. Healthcare can help, but the core business, I think, is at risk.
John, you're a big reader. What does the Mueller report tell us about healthcare?
Absolutely nothing. Perhaps the White House needs a bigger mental health benefit?
John, my guess is the redacted part talks about supplemental benefits, pre-existing conditions, the Affordable Care Act. We'll have to wait and see.
You'll keep waiting. So, David, the Red Sox last year, Red Sox this year, think they're going to win the World Series?
John, we called it in April, and I think we were smart but also lucky. What I'm going to say is they let the players rest too much in spring training, and they'll wake up around May or June. And I don't think they'll win the World Series, but I hope they will.
I think you're probably right. This is something we can agree on. It's really hard to repeat, but they're a great team, and I expect better results through the rest of the season.
Well, that's it for this edition of Care Talk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, CEO of CareCentrix. Thanks for listening.
See you at the ballpark.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.